Okay, everybody, welcome to today's presentation on best practices for collecting patient payments. My name is Mark Carm, the Vice President of Marketing for Advanced Data Systems. We welcome you all to the call today. We are going to start on time. We have some people coming in, but we're going to get started. Everyone is here today because we all know that you can't give patients too many ways to pay you. And at a time when obtaining every dollar for every visit is important, you want to make sure that your arsenal is filled with tools to help patients pay you. And that's why we have TSYS on the webinar today. TSYS has been an ADS partner since 2005, and we share hundreds of active accounts together. And together, our clients are submitting, you could say, 200,000 transactions we're going to do in 2017. And so we have Ben Buchanan, and Ben is the Director of Relationship Management to TSYS. And Ben will take us through how to give patients any way possible to pay you. Okay, Ben, thank you.
Awesome, Mark. Thank you. Are you seeing my screen okay?
Yes, and we hear you good. Thank you.
Oh, perfect. Well, Mark, thank you for the introduction. On behalf of TSYS, excited to be here today. We appreciate you carving out a little bit of your time for us to get a chance to talk about, as Mark mentioned, a very important topic in healthcare today. I'm a little biased, but I'd argue it's one of the most important topics that we could be talking about around healthcare because, as you guys are well aware on the phone, some of the dynamics within the healthcare economic system have changed pretty dramatically over the past couple of years. The one thing that I did want to mention before we get started, if you have questions, please feel free to submit those via the chat function in the screen or the WebEx. We'll be happy to take a look at those questions and answer those either as we go throughout the presentation or at the end as well. If there are some questions that we don't get to or maybe don't have the full specifics on, we can follow up via email as well after the presentation. So what I wanted to do is lay a little bit of framework for why we think this is a really important topic. I think several folks on the phone will probably be nodding their heads in agreement as we walk through the content today. But when we think about patient payments, it's a very broad concept and a very broad strategy that a lot of practices are employing. And what we wanted to do, as Mark mentioned, we've been partnered with ADS for going on 12 years now. We're talking to providers on a daily basis around what are they doing in the marketplace? What tools, what practices are they leveraging to attack this trend? And we wanted to lay that content out in a hopefully a cohesive manner for you today, so that you can take this back to your practice, to your organization, and implement what makes sense to be a little bit more efficient and streamlined. But before we get there, we got to lay a little groundwork as to why we need to talk about this. And, when we think about, healthcare reimbursement, when we go back 10, 15 years, maybe even, shorter than that, the old reimbursement model was largely dependent upon, the governmental payers like Medicare, Medicaid, the private insurers, Blue Cross, Aetna, Cigna, United. That's where the majority of reimbursement came from. Not to say that the patient was completely left out of, the picture, but they were largely left out of the picture. The patient was going to pay their copay, maybe a co-insurance portion, and then, a small deductible or chunk of the deductible. But for the most part, the majority of reimbursement was going to come in from, the payers themselves. When we look at what that means for you as a provider organization, that was a relatively steady stream of income. In that transaction, it used to be more business to business, where Blue Cross was paying you for the majority of services that were rendered, or the majority of the money for the services that were rendered. So that made the balancing the books at the end of the day, the forecasting, the budgeting a little bit easier, because you knew where the money was going to come from. When we think about the new reimbursement model, that payment has been shifted more and more on the backs of our patients or consumers over the past 3 to 5 years, maybe a little bit longer than that as well. And there's a couple of industry changes, I'm not going to go through all of them, that have kind of expanded or brought this change about in a little bit faster way. The first one has to do with value-based care. And while this doesn't directly impact the patient financial continuum directly, the indirect ramifications of value-based care on patient payments can have some pretty significant impacts on a practice. When we look at the stat here, the government insurers as well as some of the private insurers are looking to transition 75% of reimbursement over to a value-based care model over the course of the next couple of years. So we think about the indirect implications on your practice. One, you have a lot of staff that probably spends a good bit of time chasing down bills today, or leveraging some inefficient practices to ensure that you're getting paid for services. Moving forward, those staff members are going to have to be bought into the equation of providing a great customer experience to the patient, because a lot of the reimbursement models in value-based care are tied to the overall patient experience side of the equation. You're not going to have time to do chase down collections and call patients up. You're going to be focused on that overall patient experience within the practice, beyond just the care that the patient is receiving as well. In addition to that, we've got employers in the private insurance market that have been looking at ways to cut costs around their benefit expenditure. So we look in 2004, only 4% of enrollees in a health plan sponsored by the employer were in a high deductible health plan. And we're defining a high deductible health plan as a health plan with a deductible greater than $1,000 for an individual or $2,000 for a family coverage. Fast forward to 2014, and that number jumped to 20%. If we look at 2017 and some of the metrics that have taken place, since then, that number is dramatically higher than where we were, back in 2014. So more and more of the insurance coverage that we have as consumers is tied to a higher deductible. We take that same concept and apply it to, the exchanges that were set up by the ACA. You had 11, 12, 13 million people covered by the exchanges as part of the Affordable Care Act. Greater than 90% of the people that bought a health insurance plan from the exchanges bought a silver or bronze plan. I think the silver plan, I may get this statistic wrong, but had a deductible of $3,500 or somewhere north of $3,500. So when you think about that, those 13 million consumers combined with the 25 to 30% of folks that are in a high deductible health plan today, a good chunk of patients walking through your doors today are going to have a deductible greater than $1,000. So that just creates a very unique challenge. So not only you're collecting the copay, you're collecting the co-insurance, but you've got to worry about the deductible amount that's coming in as well. So we think about that. What are the impacts that this has on your practice and the reimbursement model has on your practice? And a couple of stats that are important. One, when we think about the collections process, for every dollar of care that gets sent to collections, you're only going to see about 16% of those reimbursable dollars. So again, for $100, the true statistic is about $15.77. What that means for your organization, depending on the size, is that can be hundreds, thousands, millions of dollars of uncompensated care that you're never going to see. Again, 84% is the other side of that metric that you're never going to see. So when we think about that, this has become a top 10 pain point for physicians' practices across the United States. 96% of the folks that were seen in this survey said that this is a top 10 pain point. So what we see is every practice, regardless of size, specialty, focus, needs to constantly be evaluating and reevaluating the strategies you have in place for capturing payments today. And we think one of the fundamental building blocks for establishing that strategy is creating a cultural shift around your practice and around the way you think about patient payments. The majority of folks that get into healthcare, by and large, probably got into healthcare because it's one, a safe job, but two, you like to help people. Your practice's mission is probably tied to the well-being of your community or the patients that you serve. And so while that's important, we want folks to focus on that. We also have to remind ourselves that a healthcare practice or healthcare organization is a business, and our ability to attack the patient financial trends, maybe the difference between, financial viability or profitability over the course of the next 5 to 10 years. We're seeing consolidation happening in the industry. We think that, one of the trends around consolidation is, the ramifications of a physician staying independent means, more and more processes and procedures to get paid. So, we think this is a tool to, for those of you on the phone that are looking to stay independent as a practice, making sure you're attacking this trend is a byproduct of that as well. We also think that it's everyone's issue. It's not just the providers or the CEO or the CFO within the organization or the office manager. It's the front desk staff, the back office staff, nurses, providers, leadership, everyone in between. Everyone has to be bought into the goals of the practice and understand these trends, because everyone's going to play a part in this process moving forward. So with that, I want to walk us through 5 best practices that impact the patient collections process. And the first one we want to talk about, again, from a foundational standpoint, is educating everyone within the practice around why this trend is important. One of the major things that we see in the healthcare transaction is, I would argue it is the most difficult transaction in all of healthcare. Unlike going to Target and buying a t-shirt, the one thing about that emotional decision is it's very unilateral. You want a t-shirt, you go buy a t-shirt. In healthcare, the emotions that take place at that checkout desk can run the gamut of excitement, fear, doubt, happiness, and everything in between. Generally speaking, when someone is handing you a credit card or a check to pay for services, the emotions running through their mind are tied to the conversation they just had with the practitioner back in the exam room. And with that, every conversation that takes place needs to be handled with professionalism, with courtesy, with empathy. And I know that sounds intuitive, but not everyone at your practice is going to be comfortable having that conversation. So it's really important for you as a team to think about, who's having those conversations with patients and making sure they're comfortable having that hard conversation in some cases, with the patient. Being knowledgeable, being articulate in why, the bill is what it is or why it is what you owe can help to disarm that patient so that they're, in a much better place, when it comes time to actually pay for services. In addition to that, being knowledgeable about the options that are available to the patient are also extremely, important as well. A lot of folks out there may not have the funds available to them to pay that $1,000 deductible. There's other, financial stresses on the home. So being able to talk to them about, payment plans or patient financing options or whatever your practice chooses to do, moving forward, it's really important to be able to, have that conversation in a professional, courteous, and educated manner. In addition to that, it's not enough to have educated staff. Empowering them with the tools to have the right types of conversations, the right types of communications with patients is also extremely beneficial. When we think about, the way in which value-based care is going to have some impacts on practices moving forward, if you think about the billing process within your organization, that could be the last 5 to 10% of the overall care continuum. And that patient may have had a great check-in experience, a great, exam experience, a great diagnosis, very happy with the care that they receive, but then the billing process on the back end becomes burdensome on the patient. And that last, touch point that they have with your practice is a negative one. They're going to now associate your practice, potentially, I shouldn't jump to that conclusion, but there's a chance that they associate that billing experience with their overall experience with the practice. So when we get into that value-based care model, now it's important that this becomes a part of the overall patient satisfaction within the visit. In addition to that, using tools like email, text, or secure email, secure text message, reminder phone calls, or upfront phone calls about what you expect the visit to look like from a financial perspective can disarm that patient when they come into the visit and are ultimately asked to pay for or pay the bill. What's important around, or what we see in terms of healthcare literacy is most patients don't know, what a deductible is or what a coinsurance is or what the difference between copay and coinsurance is or why their insurance company paid or didn't pay for certain elements of that. So if you communicate what's going to take place up front, as to the best of your knowledge, you're not going to know everything about the visit. It allows the patient to do a little bit of homework as well, maybe call their insurance company to understand why certain things are covered or certain aspects of the visit are covered in a certain way. So again, it arms them with as much information up front before that visit as they possibly can, so that when they get there, they're not going to beat up your staff or have questions around this process. They've been given the information up front and in advance. In addition to education and communication, on a little bit more tactical front, anything that you can collect up front is extremely important in the overall patient financial process. If we think back to the statistic at the beginning of the presentation where you're only going to see 16% of the dollars that go to collections. Well, if you got a $100 bill and you can get $25 of that up front, you're already in a much better place than you were in, if you let that bill get to the collections process. So collecting copays at check-in, if you have tools at your disposal that allow you to do some sort of estimation, or pre-authorization, so you have some idea of what that balance is, go ahead and capturing some of that payment up front. And then one of the things that we've seen, we're not necessarily endorsing this practice, but some of the bigger organizations that we've worked with, we've actually seen them go to the extent of incentivizing some of their staff members for capturing payment up front. That's not going to work for every organization. Like I mentioned before, some people are just not going to be comfortable at the front desk asking for money. It's not an easy conversation to have. So again, we're not endorsing that. But it just goes to show you the extent that some organizations are getting into in terms of attacking this trend, head on. And we'll talk about some of the tools that you can leverage and some of the subsequent slides as well. In addition to, and I think Mark made this point at the beginning of the presentation, and he's spot on, in addition to collecting payments up front, arming yourselves with as many tools as possible to capture payment is foundational to having a successful strategy. TSYS is one of the largest payments processors in the entire country. We just happen to have a very core focus on healthcare as well. But what we see across the entire spectrum from a consumer standpoint is 70% of all U.S. consumers use 3 different types of methods to pay bills, whether that's on the phone, online, via the U.S. Postal Service, pay by text, whatever the case may be. So you as a healthcare practice need to arm yourself with the different mediums and tools to be able to accept payments when and where the patient wants to pay. So that may be leveraging, a kiosk solution at your front desk, in addition to having a credit card, machine or terminal at your front office desk as well. Sending statements in the mail, while potentially not the most efficient process, still a very lucrative and beneficial tactic to leverage within your practice. Leveraging secure email and e-statements processes, taking payments on your website or through your patient portal. All of those solutions create an entire spectrum of tools that allow your practice to get paid. In many cases, they allow you to get paid while you sleep. If you think, for instance, online solutions that are available through your website or your portal, you don't have to have a staff member manning that solution to get paid. The patient can pay online 24/7 access, so get paid while you sleep. In addition to that, making sure that your practice is set up to take credit card, debit card, HSA, FSA, check, ACH, which is converting a check to an electronic payment. Again, when and where and how patients want to pay is fundamental to having a successful strategy moving forward. In addition to having those tools, different ways to take payments over the course of time is also important. So leveraging electronic statements, leveraging reminders through email, secure text messaging, setting up a card on file program or recurring payment plans within a secure system is very important as well. Not to take this down a security trail, but one of the things that we do here from time to time is practices leveraging Microsoft Excel to keep a running tally of their recurring payment plans they've set up with patients. While potentially efficient in terms of consolidating the data, from a security standpoint, you don't want to house that data on the desktop of a particular PC or machine within your network. So there's definitely tools available to you that allow you to securely store that cardholder data, as opposed to keeping them on your PC where someone may be able to steal that file and do something else with those credit card numbers. But again, leveraging these tools as a way to meet the patient where they are. Again, if they can't pay their deductible up front, setting a payment plan up to pay that deductible over the course of time can truly make an impact on the overall financial profitability of the practice. And some of the stats that we see around recurring payment plans, 44% increase in overall card transactions, which translates into more money coming in terms of 33% increase in monthly sales. In your case, you would consider that monthly reimbursement or patient reimbursement. And then also one of the unique things around recurring payment plans is practice retention of patients. Depending on the type of practice you are, you may have patients that aren't necessarily tied to your practice for a specific reason. You can think about a recurring payment plan the same way the YMCA down the street would think about the subscription plan that they lock a patient into or a consumer into as well. When a patient is paying you a consistent amount of money on an ongoing basis, they're more than likely going to be tied to your practice. We work with a lot of physical therapy firms and chiropractic firms that leverage this as a way to keep that patient coming back to their practice individually. For a lot of primary care practices as well that are setting up chronic disease management types of programs with patients as well. This is a way to, again, keep that patient coming back to the practice to adhere to that care plan. So when we bring all these things together, I wanted to provide one kind of streamlined picture of what a comprehensive strategy would look like. So first and foremost, collecting copays at check-in or at checkout, depending on the way your practice is set up, is the fundamental building block to capturing payment up front. Then again, after the services are rendered, setting up the patient on a statement process. The one thing about the statement process is it can take a long time to get paid, by and large, and generally speaking, it's 3 to 4 statements before that patient is actually going to pay that bill. And after that, you may have some routing rules that say we want to send that patient to collections. But again, this is a prong that you want to probably continuing leverage within your practice. Not only that, depending on the types of patient demographics you have within your practice as well, sending a bill in the mail may be the preferred way that patients want to see their bills coming in. After check-in and check-out, if you have the ability to estimate the balance, whether it be coming directly from the insurance company or from some other tools that you have in your practice, go ahead and collect what's owed at the time of checkout. There may be some patients that say, hey, look, I thank you for the estimation. I'm just not going to be able to pay that bill today. That's okay. Go ahead and get their credit card or bank account information, store that on file, and then after adjudication takes place, give that patient a call and set up a payment plan for them to take the payment or just capture that post-adjudicated balance. Again, if they can't pay that full balance, that's where you would take that credit card that you've stored on file and establish a payment plan to collect that reimbursement over the course of time. So when we look at this is the, in a basic sense, the continuum of tools that you could leverage to capture payments within your practice. So I want to make sure folks get back to their work day in an efficient manner. So we'll close out here, but the bottom line, when we think about your practice, we need to think about our practice as a business, and we need to think about our patients as a consumer. We've all heard consumerism in healthcare. It's a big buzzword that's out there. In the past, reimbursement was business to business. It was a B2B transaction by and large. Now our patients are going to look at our overall billing process like they would a consumer, and patients are more likely to choose a practice that not only provides excellent care and excellent processes, but an efficient process as well. So leveraging these tools to create that efficient process is absolutely beneficial to the practice. And every healthcare practice, we have no idea what's going to take place in Washington over the course of the next 12 to 24 months around legislation. But I think the trends that we've talked about today, throughout the presentation, they're here to stay. I think that's the new normal for the foreseeable future. So adapting to this new normal is going to be important for your practice, moving forward. But at the end of the day, for those practices on the phone that have already put time and effort into thinking about these things and evaluating these strategies and have already taken some steps to create a more efficient process for your practice, kudos to you guys. Any action you take in creating a positive experience for the patient is going to be beneficial for that patient themselves, for their families potentially, but also more beneficial for your staff as well, making their jobs just a little bit easier and a little bit more, customer friendly, and hopefully, prevent some less angry customers on the back end as well. So, kudos to you guys on the phone that have already taken some steps to do that. So with that, I'm going to pass the controls back over to Mark, and we will see if we have any questions that we need to answer as well. All righty. The first question is, at a minimum, what do you see most practices leveraging in terms of technology tools? That's a great question. I talked about a bunch of them, some of which are not going to make sense for a lot of practices. For instance, when we're talking to healthcare providers and, they talk about a kiosk solution within the practice. Well, if your patient panel is typically older, not as tech savvy as some practices out there, a kiosk may not be the right solution. So at a minimum, what we do see people doing is leveraging an in-office solution. So having, an efficient process around your, credit card, taking, terminal or machine at your workstations, both at the check-in and check-out process, but also in the back office when folks are making payments over the phone, having a consolidated tool to take payments through that mechanism as well. But in addition to that, leveraging online capabilities, whether it be through your practice's website or a patient portal for people to log on and pay bills. A lot of times we see patients leveraging, family members and different expertise to make payments. So they choose to pay those bills online when they can have help in making those practices. So I would say at a minimum, make sure you have some sort of, we call it e-commerce solution, but that's just an online solution to take payments. And then, an in-office solution that accommodates both face-to-face transactions where a credit card or check is physically presented to you, or an over-the-phone transaction that, someone calls in. Again, not to make this a security conversation, but one of the things that you can do from a security best practice as well is educate your staff to not write down, bank account or credit card information. That can fall into the wrong hands. So they should treat credit card information very similar to how they would treat PHI within the practice. So if they do have, for whatever reason, write that information down, make sure they dispose of that via, a secure method, whether it be shredding it or some other, security practice that you have within your practice. Then the last question it looks like is, can you explain the difference between card on file and recurring payments? Again, a great question, and there is a subtle difference. Technically speaking, they're kind of the same thing. A recurring payment plan is built off of a card that has been securely stored, which is a card on file. So generally speaking, what a practice will do is log into some sort of system online and store a credit card from a transaction that's taken place, whether it be through the online or face-to-face standpoint. And with that card being stored, now if a patient does call in, you can ask them, hey, do you want to use the last card ending in 1234, whatever it is. So it just makes for a little bit quicker checkout process. But a lot of systems will actually allow you to take that credit card and build the installment plan off of that stored credit card that's on file there as well. One of the common questions we get when we work with practices to build recurring payment plans is, well, what happens if that patient's card gets breached and Wells Fargo sends them a new one in the mail? We actually have some reporting in our system that allows you to look at cards that are set to expire and things of that nature, or failed transactions, and you can build a process to call those patients back and update those accounts to ensure that you don't miss any revenue on the back end as well. One of the cool things about recurring payment plans is once you get them set up and built for the patient, outside of any changes that need to be made, on an ongoing basis, that payment plan is going to fire, and it's money that comes into your practice on a fairly routine and consistent basis.